370, and that includes a holding cell. In other words, with his 528, he wanted 500 beds and 20 in a holding cell and 2 or 4 in a medical cell. But if our 370 included all of that, and we go to 528, that's a 40% increase. And I don't think we need that at this point. We haven't given our alternatives to incarceration, our diversion programs, and our thinking matters, and various remedies, I hope they're going to be remedies, a fair chance to operate and be seen for what they can accomplish. And all of these locations, these 3 locations that we're down to now, all have opportunities to expand if it turns out that the state is going to force more convicts into the county. So I think a total of 500 is plenty at this point. The other topic I wondered about is the hospital location. How much of that property would have to be bought? In other words, if Trinity Health wants to sell the whole shebang there, we got an awful lot of buildings between the Hickory Village Apartments and the old birthing center, which he's calling GYN Center. There are probably 24 individual doctors' offices there, separate little buildings. We have, if we have to buy all that?
30 seconds.
30 cents each?
30 seconds.
30 seconds left.
And also, the rest of the, what we call the main part of the hospital, doesn't look as though it would be used. You'd have to be buying all that, going, and including the urgent care center, all the way over to Harvey Street. I think it's something that hasn't been mentioned anyway.
Well, I'll answer the last part of your question first, because we aren't to that point in the study. That's the next step, is to start crunching the numbers basically. So that will be done, I'm sure.
But not only the cost of the program, but things that would not be utilized.
Right.
No,
that's all going to be looked at. Nell Schaefer.
I have a couple of questions. One is there a timeline for the study for the numbers? Is there a date in which those will be presented?
Well, my notes say, if I can, and Joe will jump in, that there's no set date. Next steps are to complete the study, schedule, and come up with a schedule, complete the study. Next meeting of September 20th, the next meeting of this committee, we should have a kind of a schedule figured out, right? Is that?
Yeah, right now we estimate it'd be at least a month or 2 to finish, and a lot of it depends on the time frame in which it takes to collect the additional data we need to get.
Okay, the reason I ask is just that I think that specifically with the budget and the numbers, that's been something that has been asked of this committee and also the county commission as a whole for, since this process started, which was about 5 or 6 months ago. And then we were promised all that information, at the charrette, and then showed up on Friday morning and it was ending when I thought it was supposed to be a 10 o'clock presentation of the numbers. So I'm just hoping that you can get that information as soon as possible and also make sure that it's not just said within this room, but also advertised. A couple other things I wanted to mention were, I think something that you said earlier, Sheriff, about programming, and one reason that we have to have a new facility is because we don't have space for programming at the current facility. But I think that the unfortunate thing is that within this plan that we also have to have more beds at a new facility. And I don't think that's the case. I don't think we need more beds. I think other people have expressed that we don't need more beds. And that's not contributing to primary prevention. It's not an effective model because, again, if we just have increasing incarceration, we're not really addressing the problems. So I think that that's used as an excuse of why we need a new facility, but then we also need to look at why do we actually need more beds. And I don't think we need more beds. I think we should keep it how many we have or reduce it. Another thing too I wanted to mention was the video visitation. I'm really, really concerned about the video visitation at a new jail. I think if we talk about ways to prevent recidivism and also to keep familial connections when people are incarcerated, being able to visit in person, specifically with parents and children, is absolutely necessary. It's not just important, it's crucial. And I think that I would immediately like to see video visitation taken off the table. And I don't see any reason for video visitation. I think the reason was less people in and out of the jail. But I think people are going to be going down there anyway, right, to hook up to some video to see a loved one. And I don't think that, yeah, I think that should be taken off the table immediately. And the last thing I think was the public defender system and access to legal representation, specifically for people who are appointed public defenders and can't afford other legal representation, and having a jail that is not next to the courthouse would provide, I think, less time for inmates to be able to meet with their representation. I think that's a big concern as well. We already have a pretty bad public defender system here, and I don't think we should make it worse.
Got about 10 seconds left.
I'm done.
All right, thank you. Okay, I don't want to put anybody on the spot, but is it Deb Schultz?
Yeah, sorry.
If I may.
Is this in regards to the upcoming meeting,
No.
the Ways and Means meeting?
Yes,
I have to
this
wait?
is the wrong meeting.
Oh, okay, thank
I
you.
talked to Deb yesterday. Okay, sorry, Deb.
Okay, that's okay.
Okay,
Will we adjourn?
motion to adjourn and at least one support, I know. Support. Okay. All in favor, say aye.
Aye.
We're adjourned. Thank you, everybody, for participating.
2012. Motion been made, seconded. Is there any questions or corrections? Seeing none, all in favor say yes.
Yes.
Opposed say no. Motion carries. Next item on the agenda is public comment on an agenda item. Is there anybody in the audience who'd like to comment on an agenda item? Seeing none, next item. Oh,
Yes,
excuse me.
I
It's on it. Deb, you'll be on the last one.
Oh,
If I may, I'm kind of familiar with what Deb's going to say, and I think her comment wants to come during the public hearing on the budget, because it involves cuts, if I'm correct.
whenever you want me to talk, I'm fine.
But I
We'll
think,
let you eventually.
but I think it's during the public hearing portion of this, okay?
That's fine.
Okay, next item for consideration, WM 12/09-1.
Oh,
I'm sorry, I passed up. Hey, you confused me, Jim.
That's what I messed.
Next item is public hearing,
Nobody opened the
2013.
public hearing.
Second. Thank you very much. Move second, open the public hearing. Public hearing now open, now.
Now I can talk? Okay. Okay.
Sorry about that.
That's all right. I'm flexible, Jim. No problem. Okay. My name is Deb Schultz. I live in Muskegon County and have all my life, and I teach at Grand Rapids Community College. I teach dental hygiene, and particularly dental public health, among other things. But I would like to address the commission today on behalf of the dental programs in Muskegon County at the Health Department. If you remember, some of you were probably on the board back in 1999 when we approved a dental health coordinator position. Based on a lot of the problems that we saw in Muskegon County, the needs assessment that was done, there was a problem with, and among other things, dental childhood caries with children right here, close in town and all throughout our county and actually throughout the country with baby bottle tooth decay. And so in order to address that issue, I have some pictures that I'll actually show you that were taken back then. Well, this problem has been addressed and we've reduced it significantly, but it's still an issue. And I would really like to be available if anybody has any questions regarding what we can do as far as dental public health in the area of prevention. As a dental hygienist, I've been teaching for 24 years in Grand Rapids, and the students have to have 3 years of education and relating to health education as well as dental education, and there's more and more evidence that prevention is the way to go. Doesn't only prevent childhood caries, it can prevent early delivery, premature birth of babies. It can help reduce the severity of diabetes and heart disease, and that's among some of the many other research things that have been proven that dental health is really essential. And prevention is a heck of a lot more inexpensive, tenfold plus, rather than treatment. And some of those pictures that you're seeing, the babies actually have to go into the hospital under general anesthesia, and this could be prevented. And so I've given you some information, and I apologize for the way that it looks. This kind of took me off guard. Classes are starting. I teach full-time in Grand Rapids and live here, and so I just had to add more things on the end of it. So I wanted to make sure that you got it. And so things are listed. Also, the nursing home program that we'd like to get started. So if this goes away, that position goes away, so does any dental health. It's going to promotion that's going to happen as far as from the public health department. And so I'd really like you to consider that. And consider please also, if health education in Muskegon County wants to get ramped up a little bit, a dental hygienist could perform health education as well as coordinate a dental health program. But simply a health educator cannot present dental health information in the way that it should be. Also, I understand budget constraints and things like that, but there's a lot of grants out there nationally and through the state that can help to supplement this program. They just need some direction to be able to have people find those grants. And Jackie's been the person that's in that position now, taking grant writing classes in an effort to try to increase that. Also, for the last 13 years since Jackie's been in that position, I have taken part with Jackie and partnered with her and bring the dental hygiene students over to Muskegon County we've done several things to help with that. And I'm very familiar with this situation because back in the early 80s, I was the dental health coordinator for Muskegon and Oceana County for Head Start. And literally, if you can envision this, there were pictures in the paper. I'd wear my fairy suit and I'd be going from Head Start Center to Head Start Center trying to help promote dental health for parents, teachers, and the kids. And I love that, and that passion's always been there, and I convey that to my students. So if you have any questions, you've got my email address, and I'd be more than happy.
If I may, her concern is that in our budget, that this is one of our steps in adopting our operating budget, that there would be some cuts in this area. And I'm not specifically sure of what those are, but I surely, if this is Mr. Heath, if you could get us how that might be affected, because that's your concern.
That's my concern, that the entire position would be cut, and I could see that it being changed into something a little bit different to include health education component possibly in addition to dental health, but it would have to be like a hygienist that would take that position over.
Last year, I think we made a major cut in this too. Is one of our hospitals or something was supposed to be taking a lot of this over? Have they been doing that?
Well, they've been working on developing a plan, but Jackie and I have been working to try to develop this for years, and I don't even know where that's at. As far as trying to meet the emergency care needs of the community, and that would be more of the adult issues. Yeah. Hackley Hospital, on the other hand, with Dr. Rafferty, and that's some of the stuff that's on here, over the years has seen some children. Jackie's made strides, and a lot of those things are listed, and you can go onto the website, and I'm sure you guys have received reports on that. She did a 10-year report, and then she has done annual reports on accomplishments. But Dr. Rafferty used to see all the children that needed to be put under general anesthesia to treat their care. I'm not sure where that whole thing is at right now with those treatments. I know that the pedodontists in town do not see Medicaid patients, and a lot of these kids are healthy kids dental patients, which is Delta Dental now, so they should be taking them, but I'm not sure if they even see them. Okay, so we want to prevent it. I mean, you can imagine being able to prevent, put on cavity varnish, fluoride varnish for these children, and to prevent these caries and cavities, rather than have them have to go under general anesthesia, thousands and thousands of dollars, to treat these children. That can be prevented to some degree. Okay. Not 100%, of course, but we try really hard. And if we can get those kids and those parents, as somebody that's done this, while they're little in Head Start, getting used to brushing, talk to the parents, teach the teachers, then, you know, it's hard to say how many kids can be touched, but I'd hate to, you know, overlook that.
Does anybody else have any questions? Thank you very much.
You're welcome. Thank you.
Is there anyone else who would like to come forward for this? Anyone else comment on our budget?
If I may, I hope someone from staff, I know Bonnie is gone, Mary, could respond what's going on in this present budget to her concern.
Actually, I'll be happy to turn it over to Maryville Wade.
It's an odd situation with Bonnie, so, but.
I understand. Yeah, I'll plan on giving a presentation, if that's okay with the chairman, to give you guys I know for a lot of you have already seen this presentation, but however the state statute indicates a public hearing to disclose as many details as we can in the public budgeting process we have for Muskegon County for the fiscal year 13. And that's the purpose of this presentation. So if there is anything that I glossed over that needs any specific detail on, I would be happy to provide that. And so without any further ado, I'll move along. In case you're not familiar with the county's budgeting process, we have moved over to a different planning model that we had from previous fiscal years. The first year was the 12 planning process, to which we have moved alike departments into functional budget teams. And these teams are, as you can see, as listed on the screen, they meet and confer with one another, and you try to find ways, unique ways to meet objectives for the county instead of doing the old historic 5% across the board cuts. Those are very destructive. We don't feel they're fair, and this model provides more equity across the board in regards to the county's core functions. And if you're not familiar with what the county's core functions are, those core functions are one, listed on the county website, but two, what they are is we have put together in a matrix of functions, so which ones are mandatory, which ones are discretionary, and everything in between. And so with that, we take into consideration the teams of like teams by function, but also which teams have more discretionary versus mandated core services. And those departments that have more mandated services obviously have less of a burden as to cuts, as to a percentage of cut, than the ones that have discretionary cuts. So that's how we've approached it here in Muskegon County to make sure it's more fair, it's more equitable. And it also encourages an environment to which we are constantly talking with between departments with one another to find ways to either consolidate or to gain on the economies of scale with one another, and et cetera. So with that model, and again, this is the second fiscal year which we've done it, we were given a target, $1.8 million of reductions. Either through, I guess let me retract that, it's not necessarily $1.8 million in reductions, it either is reductions or revenue enhancements. And so with that, you can see from the table that we have exceeded those expectations for the second straight year. And that's good news. It tells you that, one, the model, I think, is really taken a hold, and I think it's being well received within the different departments. So with that, you'll see that, again, not siloing these efforts as to who did what. It shows you as a team, we accomplished the goal, and not only accomplished it, we exceeded it. And so I'm very proud of that. I'm very proud of the team, and my hat is off to them for pulling it together yet again and for